everyone, my name is Pablo Barrios. I work here at St. John's Wild Child and Family Center. I'm a community health worker supporting with triage and crowd control. At the moment, we still have our doors open here at St. John's.
You know, we're serving the homeless, we're serving the vulnerable, we're serving the undocumented, we're serving low-income families. Those are the folks who are most vulnerable in a pandemic like this.
We're taking the temperature of our patients, and if they show any symptoms, we're triaging them away from our lobby.
The situation is critical on the front lines here. So we don't have the cuffs for our thermometers so that we can test everyone. We're running out of those. We're running out of N95 masks, surgical masks. We don't have lab coats. We don't have enough gloves. For our 5,600 patients we see a week, we have 25 tests. We're on the front lines, and we don't have the tools that we need to protect our workforce and to protect our patients from the spread.
We have our triage tank where we're separating patients. If any patient has a cough, a high fever, shortness of breath, before they can even enter into the clinic, we're triaging them here in this tent.
One of our employees' fathers works in a factory in China, and they make masks. And so she was able to contact her dad. We were able to wire him a whole bunch of money, and hopefully by Monday, we'll have 100,000 masks delivered from China. We had to go to China to get them. And I'm afraid because of the failure of the Trump administration to move decisively, their failure to get us the test kits we need, their failure to get us the supplies we need, and the fact that we lost 8 weeks since the first case hit the United States, that we actually got those tests out to providers like us, I'm really afraid that we're way behind the curve and we're going to see a big spike in the next couple of weeks that we could have avoided. What we're seeing is not only a gutting of our public health infrastructure, but we're seeing more and more American citizens losing their health coverage because of decisions and policies being made by the Republicans and Donald Trump that are putting them at risk. Because we know that when someone is uninsured, they will access health care much later in the disease chain and when their symptoms are much more advanced. And so we now have millions of people, more than we had 3 years ago, who are going to be afraid to access services if they start to have symptoms because they're now uninsured. So I couldn't think of a worse situation. I couldn't think of a worse response. I couldn't think of a more incompetent response if I was writing a science fiction novel.